We're going to take a look at connective tissues. Connective tissue differs from epithelial tissue in a couple of ways. First off is how the cells are arranged. The cells are arranged very spaced apart. A difference in that epithelial tissue, the cells are very close together. They typically appear in rows and columns. But in connective tissue, you may have a cell here and then a cell down here, and then there's space between. We call that space extracellular matrix. Now, within the extracellular matrix, you have fibers and you have the fluid. The fibers can be one of three types. They can be collagen fibers, reticular fibers, or elastic fibers. The fluid is what we call ground substance, and it's mostly water with some ions, nutrients, waste kind of dissolved within that fluid. We're going to take a look at the types of connective tissues. Now, what you're seeing right now is how the connective tissues are divided into categories. We're going to focus on those first three categories that you see, but I don't want to leave out bone and blood because those are also types of connective tissues. We just mainly focus on bone when we talk about the skeletal system, and then we focus on blood when we talk about the cardiovascular system. For the purpose of connective tissues, we're mostly going to focus on these three categories that you see: the loose connective tissue, fibrous connective tissue, and the cartilage. In the loose connective tissue category, it gets this name because the cells are very spaced apart and you have lots of ground substance. There tends to be a bit more fluid in the loose CT versus the fibrous and the cartilage. The cells are spaced apart and you can find collagen fibers, elastic fibers, and reticular fibers between the cells. The fibrous connective tissue category is made up of three main types: dense regular, dense irregular, and elastic. In this category, you tend to see less ground substance, so less fluid in the extracellular matrix. And there's many collagen fibers. And in the case of elastic connective tissue, you have elastic fibers intermingled among the collagen fibers. The third category is even less ground substance and a bit stronger than the previous two, and that's cartilage. Cartilage has a main function of being providing shape and support for tissues, a protective nature in it. And there's three types: hyaline cartilage, elastic cartilage, and fibrocartilage. And again, I don't want to leave out bone and blood because those are two types of connective tissues. We're just not going to focus on identifying bone or blood in this tutorial. First, we're going to start out and take a look at the examples of loose connective tissue. So here we are with our three types of loose connective tissue. Now I'm going to add a heading up here at the top that just says loose CT. Now remember, this category of loose connective tissue means that the cells are spaced apart, tends to be a good bit of extracellular matrix, and it's loose by nature. It's kind of squishy, has a lot of fluid and flexible in nature, soft tissues. The three that you're seeing here are microscope images of areolar, adipose, and reticular. So the first one up that we see right here is areolar. An areolar CT, if you can read my handwriting there, is a loose CT. It's widely distributed throughout the body. We typically call it packing material because you find it virtually everywhere. It's found underneath mucous membranes. It's part of the tissue that forms synovial membranes, which is what lines your joint cavities. We can find it around various organs in the body. It consists of a meshwork of collagen, elastic, and reticular fibers. Here in the picture, you're seeing that pointer on the microscope pointing at a collagen fiber. I'm going to outline it right here so you can kind of see what I'm talking about. That little pink, it's very pale in color, but that pink line is actually collagen fiber. And the darker circles that you see, I'm going to outline one right here. There's one, you see them kind of all throughout. Those are fibroblasts. Fibroblasts are specialized cells that produce fibers. So in areolar CT, you have a lot of collagen fibers, you have fibroblasts. You can actually find elastic and reticular fibers present in areolar tissue as well. The tissue acts as a cushioning layer. It supports, it binds other tissues and organs. It provides a reservoir of water, salts for surrounding tissues. A lot of time, if a tissue or an area of the body is suffering from edema, swelling, it's actually this areolar CT that's holding that extra water and housing that fluid, causing that edema that's there. The second example of loose CT that you see here is adipose tissue. So I'm going to name it adipose. Adipose is what we commonly call fat. This is fat tissue. It's specialized for the storage of energy in the form of lipids. Now, when you look at this, you see these big, huge cells. They look empty. They're not empty. They're actually full of triglycerides. Triglycerides is the form of fat. It's how we store lipids, is in triglycerides. I'm going to circle one here. You see, this is a cell right here. Here's another cell beside it. You see, there's not a whole lot of matrix between these cells. That's because these adipocytes are all swelled up, full of lipids. I'm outlining all of them right there. We call these cells adipocytes. I'm going to draw an arrow right here and write that word. Adipocytes. I had a moment. Adipocytes. So fat cells basically is what that means in medical terminology. That suffix "cyte" is cell. That prefix "adipo" is talking about fats or lipids. That's what that means. So adipose tissue is found several different places surrounding your organs, underneath the skin, in the dermis, or actually the hypodermis or subcutaneous layer of the skin. We have adipose tissue surrounding your kidneys. It serves, as we mentioned, as an energy storage tissue because it's storing those lipids, those triglycerides, but it also insulates, cushions, and protects internal organs, and actually plays a role in hormone production because of the lipid that it's storing can be used as cholesterol to produce various hormones. The third loose CT that you see here on the end is called reticular connective tissue. Now I'm going to write it at the top so you can see it. Reticular. Reticular connective tissue is characterized by a network of thin collagen fibers. They're actually called reticular fibers. It's a modified collagen fiber. So all the little dark lines that you see running through are reticular fibers. And the dots that you see scattered throughout, I'm going to circle a cluster right here. Let me change the color of my pen so that you can kind of see it a little bit better. Maybe that's a little better. You can see those little dots everywhere. Those cells are actually called reticulocytes, and reticulocytes are responsible for producing those reticular fibers. Reticular tissue tends to form the supporting network of soft organs, things like your spleen, lymph nodes, tonsils, appendix, very delicate, soft organs. Are mostly composed of reticular connective tissue. It can function in filtration of bodily fluids, the production of immune cells. Reticular tissue also tends to be the location for cloning of lymphocytes. If you think about the organs that I just named, like your spleen, your tonsils, your appendix, all of these tend to be lymphatic organs. These are areas where your lymphocytes, white blood cells, can clone themselves during times of an infection. So here we have again those three types of loose connective tissue. Now, in recognizing them, here's a couple of tips. For areolar CT, look for these fibers. Lots of fibers, network of fibers running in different directions. For adipose tissue, look for these big adipocytes. They're going to look like these big empty cells, almost like a honeycomb structure to it. Those are adipocytes full of triglycerides, full of lipids. And in reticular, we tend to see almost like a grapevine network of reticular fibers with all these little dots that look like little grapes. So little grapes, little dots everywhere, which are actually reticulocytes producing those reticular fibers in that tissue. Our next category is the fibrous connective tissue group. So I'm going to make a note up here at the top and call this category fibrous. Okay, there are three examples of fibrous connective tissues in the body. The first one we're looking at is dense, regular. The middle one is dense, irregular. And the third one is elastic CT. So let's look at dense, regular first. Dense regular connective tissue is mostly composed of tightly packed collagen fibers. They tend to look like waves. They all run parallel to each other. Now, the picture that you're looking at here at the beginning, the fibers are running horizontally all across. The little dots that you see, I'm going to circle a few of them here. These are fibroblasts. Fibroblasts are largely responsible for producing collagen fibers. So all these little cells are fibroblasts. And the sea of pink that you see throughout, that's the collagen fibers. And again, in dense regular, let's go ahead and write that name here. Dense regular CT. Okay, dense regular connective tissue. It gets that name regular because the fibers run parallel to one another. So the arrangement of those collagen fibers typically all run in one direction. It makes it ideal for structures that undergo consistent stress along a single plane, like tendons, ligaments. Tendons attach muscle to bone, ligaments attach bone to bone. Those are made of dense, regular connective tissue. And having those fibers run parallel in one direction makes it really strong for movements that happen in one direction, in one plane. The middle example that we're looking at is called dense irregular. So I'm going to write this, dense irregular CT. Dense irregular gets its name because the fibers do not run parallel to one another. You can kind of see these swirls of pink. The pink that you're seeing is the collagen fibers, and notice they're running in several different directions. Some may be running horizontally, like this one right here has a bit of a wave to it. Here's one that's running a bit vertical, almost at a horizontal, not a horizontal, at an oblique plane, kind of diagonally. You've got some that are running upwards, more vertical. So all these fibers are running in different directions, which is how we get this name irregular, dense irregular CT. This allows for strength in multiple directions. This type of tissue provides that structural strength. It's found in areas like the dermis of the skin, fibrous capsules of organs, joint capsules, where you may have movements in different direction. So dense irregular CT, this particular picture is actually taken from the dermis of the skin. So remember, outer layer of the skin is called epidermis, lower layer of the skin is called the dermis. Dense irregular CT is found in that dermis, that dermal layer. The third example that you're seeing is elastic CT. So we're going to call this elastic CT here. Elastic also has tons of collagen. That's the key characteristic of all of your fibers. So you see the pink waves in there. But something that sets elastic apart from the previous two are these dark lines that you see running throughout. Let me highlight those if I can do that here. I'm going to highlight. My highlighter doesn't show up very well, but maybe you'll see. I'm kind of going over these dark purple, almost black lines that you see. These are elastic fibers. I'm going to draw an arrow here. These are elastic fibers, and this is what sets it apart from the previous two tissues. Dense regular does not have elastic fibers. Dense irregular, you can find a few sporadic ones intermingled in there, but not near as much as you have in the elastic CT. The elastic CT, you have these elastic fibers running right along with all of those collagen fibers that are there. And this allows flexibility and resilience. The tissue's elastic CT allows these areas to stretch and recoil. So you find them in organs that need to stretch and recoil. So arteries, where when your blood pumps, your ventricles contract, your vessels get wide, right? That's what a pulse is. When you take your pulse, you're feeling the artery, your carotid artery in your neck, if that's where you're taking the pulse. With each beat of your heart, that artery stretches out due to the pressure. And then when your ventricles relax, it recoils and goes back down. So with every beat of your heart, those arteries are going big, little, big, little. High pressure, low pressure. High pressure when your heart contracts, low pressure when your heart relaxes. So this stretching ability for it to stretch out and recoil is possible because of this elastic CT that's there. You also see elastic CT in your lungs, because when you inhale, your lungs expand, and when you exhale, your lungs recoil. So that rhythmic breathing, inhaling and exhaling, and the stretching and recoil of your lungs is made possible by the elastic CT. The final category of the connective tissues that we're going to look at for purposes of this chapter is going to be the cartilages. So let's add our title here at the top, cartilage. And there are 3 examples of the cartilages you need to know and be able to recognize. So first up is going to be hyaline cartilage. In the middle, we see elastic cartilage. And then the third one over here to the right is fibrocartilage. So let's look at hyaline cartilage first. Hyaline cartilage tends to have a very smooth matrix. There's a lot of collagen fibers in there, but they're so densely packed that you don't really see lines between the cells. Now, let me draw your attention to the cartilage first off, because there's multiple tissue types here in this image. I'm going to separate the cartilage out by drawing a line here and a line here. Now, everything that you see right here in the center, this is the cartilage. This is hyaline cartilage that we're looking at. So I'm going to make a note here. H-Y-A-L-I-N-E, hyaline. Okay, that's the cartilage that we're looking at in the middle. All cartilages, all 3 types that you see here, are made of cartilage cells called chondrocytes. Chondrocytes always have a clear space around them called lacuna. I tend to call them bubble cells. I tell my students, look for the bubble cells, because it's a cell and it's going to have a bubble around it. That's how you know it's a chondrocyte. So I'm going to draw your attention to a few here on the image. Right here is a little fella, but right there he is. And if you look closely, you're going to see that dark dot with a clear space around it. That clear space around it is the lacuna, and that dark dot is actually the nucleus taking up most of the cell of the chondrocyte. So I'm going to label that chondrocyte. Okay, now all cartilages have the chondrocytes. All 3 of these have chondrocytes. I'm going to draw another one here. There, that's the chondrocyte. In that one, you see all that space around it, and then over here, I'm going to draw a little line, and right there is the chondrocyte. You see the little dot with the clear space around it. I know it's kind of small, but if you look around in that tissue, you can see a dot with the clear space around it. All 3 of these have chondrocytes. So how do you tell the difference? Well, you have to look at the matrix, because the cells are going to be all the same in all 3, but the matrix, the space surrounding the cells, will be different. Hyaline has a smooth matrix. If you look closely, it almost looks like all these chondrocytes are floating in a river. We've got this smooth, glassy, kind of pink matrix on the outside. Now, it's collagen fibers, but again, they're so densely packed that you don't really see the lines. It appears smooth and glassy. Hyaline is actually the most abundant cartilage that we have in our body. It's found in several different places. We have it in our nose. This part of your nose is hyaline cartilage. Your larynx is hyaline cartilage, and there's rings on your trachea that's hyaline cartilage. The growth plate that's found at the ends of our bones, that's hyaline cartilage. Covering our bones, it's called articular cartilage. It's typically found at the ends of bones, proximal, distal, between where 2 bones articulate. That's called articular cartilage. It's made of hyaline cartilage. So you have hyaline in several different places throughout the body. The embryonic skeleton, when we're developing as a baby, the embryo, the skeleton actually starts out as hyaline cartilage before it gets converted into bone. So hyaline is most abundant, found several different places in the body. Now, the middle type of cartilage, a little different. This is elastic cartilage. So I'm going to write the name elastic right here. Now again, you see chondrocytes, right? That's all those bubbles. I've got those labeled here. Here's another chondrocyte, here's another chondrocyte, another one. So there's cells several different places in here. But look at the matrix. The matrix, the space around the cells, this is how you recognize the difference between hyaline and fibro. Elastic cartilage will have elastic fibers, and elastic fibers almost always stain a deep purple or a black color. If you remember when we looked at elastic tissue, connective tissue in that dense category, we had the waves of collagen, but then those black or deep purple lines running through it. Very similar situation here where you have chondrocytes now because it's cartilage, and then you've got these purple lines between those chondrocytes. So all this just purple that you see between the cells, this is all going to be your elastic fibers. I'm just going to kind of highlight a little area right in there. That's all elastic fibers. Now, elastic cartilage, you can kind of guess by its name being elastic, is very flexible. It's able to withstand bending while still maintaining its shape, makes it ideal for structures that need that flexibility. So the external ear, this part right here of your ear, it's called the pinna. This is actually made of elastic cartilage. And then the epiglottis within your larynx, it's this little flap that opens and closes when you swallow to prevent food from going down your airway. The epiglottis is made of elastic connective tissue. It's very flexible and opens and closes each time we swallow. The third and final connective tissue type that we're going to look at today is fibrocartilage. So this one over here is fibrocartilage. Okay, fibrocartilage is the strongest of the three. Fibro has many, many collagen fibers around it. You can kind of see all those swirls around those chondrocytes. Those swirls are collagen fibers, and fibrocartilage is found in areas that's under a lot of stress, under a lot of physical pressure with it. Fibrocartilage it's the component of your intervertebral discs. So the discs in your back between the vertebrae, it absorbs shock and pressure when we walk and move around. That's fibrocartilage. You also have fibrocartilage in your knees. You've probably heard of the meniscus. The meniscus is a pad of cartilage that's present in your knee joint there, and it absorbs a lot of shock. The meniscus is made of fibrocartilage. So if you hear of someone, they tore their meniscus, that is a tearing of fibrocartilage. That's what that meniscus is made of. And you also have fibrocartilage in the symphysis pubis. The symphysis pubis is a disc of cartilage, very similar in structure to the intervertebral discs in your back, but this is found in the anterior, the front part of your pelvic girdle. So you have your right hip, you have your left hip. The anterior, the front, is connected by the symphysis pubis. It's a disc of fibrocartilage. So in your knees, the meniscus, in your back with the intervertebral discs, and then that pubic symphysis is where you find fibrocartilage. The strongest of the three cartilages, and the in areas where there's a lot of shock absorption needs to happen there. Elastic's the most flexible of the three. Hyalin's the most abundant of the three. You have hyaline in more places than any other place as far as these three cartilages go.